listening to the Pharmacy Podcast Network.
Hey, what an exciting opportunity to be part of, I don't know if you call me a storyteller, but since 2004, since I entered pharmacy, I've seen change accelerate and the patient's becoming more important than ever and being the center of that change. And I think of newspapers. I came from telecommunications. My grandmother, Veronica Urey, worked for the telephone company called Sprint way back in the day. I worked for that. And I've seen communications change literally from the inside out. So think of the written word and where that written word has taken us and communicating what we bring in value as healthcare professionals, as pharmacists, as community pharmacy owners, how you spread your message throughout the community and bringing peace and bringing assurability that they're going to be okay. Because why? Because the community pharmacist has always been there. And I think of the evolution of communication and the advent of the internet. When that exploded, I'm old enough to remember that there was no internet. And I had to do my resource via the Dewey Decimal System and go to the library to look stuff up. Well, now we have the internet. Okay, well, what's next? Let's jump ahead. We're talking about the use of digital to take your communications from where you are and how you function and how you work as a community pharmacy leader and healthcare leader. And now developing a strategy and a platform in order to push this content out that's so important in being the next gen newspaper, literally, not to sound like an old fogey, but we have a couple more old fogies on with us today. The first one that I want to bring in is one of my mentors. I want to call myself someday the Bruce Nealon 2.0 in becoming that voice for pharmacy and community pharmacy. But Bruce, I'm so proud of you, of what you've built. We've come to a crossroads together. You've built this podcast from the ground up with me, and I'm so proud of how big it's become in reaching pharmacy owners and in telling their stories. But Bruce, thank you for letting me be a small part of this.
Well, and thank you. And you mentioned the Dewey Decimal System. I wonder how many people we lost on that. Who remembers the Dewey Decimal System? So anyhow, moving forward, before we lose more of our audience, I am excited to be here today. The Pharmacy Crossroads podcast has been a joy in my life. But it's not about me. It's about the guests that I get to bring on. And you mentioned Pharmacy at a Crossroads. One of the organizations that we've got an opportunity to work with closely here is IPC, the Independent Pharmacy Cooperative. And they have just made a major change in their organization, in their operational activities and benefits that they're bringing to their members in pharmacy. And without any further ado, I'm going to say they've hired Ashton Maaraba to come in and take the lead on a totally new platform, new initiative. And Ashton, you're sitting here patiently listening to me ramble on. Just take a second, introduce yourself, and then we'll dig into the meat of what you and IPC are bringing to the pharmacists.
Thanks, Bruce. Thanks, Todd. You guys got the intro down pat, and a lot of energy in that intro, and I can't really attest to that decimals, the Dewey Decimal. Yeah. I don't know if that says I'm young or what, or maybe just not as informed as I should be, but I'll get back to you on that one if there's anything I need to report back.
Ashton, it's the original IP address. So
okay.
To find your information, you had to put in the right address to get to the information. And that's literally what Dewey did. But I just want to give a shout out to Mark Asenza. He was the first interview from the team of the IPC guys. I enjoyed that interview, and that's why we're excited to have you here to continue that executive leadership, thought leadership that Bruce brings to the table.
Did Mark get the Dewey Decimal System, or did that just come up with me?
We're going to have to
setting me up
delete
here
it.
or something, or what? Come on.
We're going to have to delete all this Dewey Decimal stuff. So go on, Ashton. Who are you, and why are we talking to you today?
Well, we're talking about innovation first and foremost. So that's probably why I'm not bringing anything about the Dewey Decimal System to the table. But so I am Ashton Maaraba. You know, I've been around for a few years. It's been a long time. And I can't believe it. I am the president of IPC Digital Health, which is a subsidiary, newly formed subsidiary to Independent Pharmacy Cooperative. So I joined the team recently, and we are working on some amazing innovations and initiatives. And I'm really excited to join the crew.
Here's a message from today's episode sponsor.
Hey, Pharmacy Podcast listeners, this is Bruce Nealand with a shout out to the Independent Pharmacy Cooperative, better known as IPC. Over the years, it's been my pleasure to work with IPC, and they have a number of programs that help pharmacy owners do more and be better. I invite you to check them out at www.ipcrx.com. Thanks. Well, you know, let's dig into this. So as your background, I know you've been involved in bringing a lot of innovation to the industry, stuff that's used in 60,000 pharmacies. You've kind of reached across the aisle. You've dealt with pharmacies, you've dealt with big retail chains, major pharma companies, and technology companies. All of that is bringing together to strengthen pharmacist collaboration with doctors and employer groups and payers, and integrating the pharmacy into that whole network. So what is IPC Digital Health?
Yeah, Bruce, I mean, you talk a little bit about my background. It's been a fun ride, to be honest. I mean, there's as you grow, you pick up little pieces here and there in terms of what works and what doesn't. I've been fortunate to see the industry from different perspectives to lead me to this current position. So first and foremost, Bruce, before we get into IPC and IPC Digital Health, I think it's really important that I'm able to recognize the IPC team, both IPC and the newly formed IPC Digital Health team. I mean, ever since I started with that group, I'll tell you the level of professionalism, energy, spirit, intellect, and commitment from the team, truly defines our organization and sets us up for an extremely successful future. Can't say enough. I know Todd mentioned Mark. Mark Assun's our CEO. I mean, his vision, his personality, his drive. I mean, it's really been extremely infectious to all of us that work together at IPC and IPC Digital Health to and serves as a springboard to IPC Digital Health. I mean, we're it's something that's going to create a very strong ripple effect, shift the paradigm in community pharmacy, and I'm excited to lead it. The other thing I wanted to talk about, Bruce, before we really kind of get into defining IPC Digital Health, is I like to set the table with stats. So everybody really understands as I start to talk about some points that defines IPC Digital Health and the brand that we're introducing to independent community pharmacy. I really want these stats to resonate with the listeners or the viewers of your podcast. I think that's critical.
Well, let's hear some of these. Let's hear some of these stats.
Let's start from the top down. First and foremost, 86% of Americans live within 5 miles of a pharmacy. And I think some of these stats you've heard over and over and over again. So, I apologize if I'm preaching to the choir here, but they're so important. 30% of Americans do not have health insurance. 52% of Americans are either underinsured or uninsured or suffering from some form of insurance gap. So think about that. That's huge. And it's only going to get worse. Premiums are going up. Insurance has just not been where we had hoped it to be. More than 9% of U.S. counties are primary care provider deserts. So you've all heard about health deserts.
Right.
An estimated 13 million Americans live in areas where demand for primary care far outpaces the supply. It's pretty intriguing.
That was 9% in a health
9% of U.S. counties
of the counties. Okay.
are primary care provider deserts. It's pretty amazing. 80% of the U.S. lacks adequate access to healthcare. That's one that gets me. Especially, we're supposed to be the leader of the free world in that sense. Another astonishing point that's part of my kind of statistical category is in the health inequity category. Demand for modernized solutions that address expensive diseases or borderline health issues in population health in areas where disease or health inequity is rampant. For example, where we see a racial disparity in ethnic minority groups, you're seeing a higher suffering of hypertension, obesity. You're seeing a greater propensity of diabetes, asthma, heart disease, cancer, preterm birth when compared to their white counterparts. So you asked me earlier, what is IPC Digital Health?
Yeah.
But when you kind of look at all those stats and that information that I'm throwing out there, you start to kind of wonder, wow, we do need solutions that make a difference and really arm our pharmacies that are within 5 miles of 80% of the American population with the right tools, both virtual, digital, and then obviously, physical tools as well. Suck that all up in a vacuum, and you get the beginning of IPC Digital Health.
And the need is overwhelming. The opportunity for pharmacists to fill that gap
it's pretty phenomenal. And I'll go through some more details for you in the sense of where we're coming from with the product, where we're coming from with our vision, and what we hope to introduce. But I think what's extremely important is when you look at us venturing into virtual healthcare solutions under the IPC Digital Health umbrella, you first have to really look at our network. And that's really important. So Bruce and Todd, I'm not sure if you guys are familiar with our numbers internally, but we have more than 2,000 IPC GPO members, plus additional 4,000 plus warehouse customers who rely on IPC as their secondary wholesaler. What does that mean? It means that we not only have a massive distribution network of customers that we distribute prescription drugs to, but that's also a massive network of healthcare providers in the sense of where we are as a pharmacy industry that can really take advantage of an untapped potential both on-site and from a virtual healthcare perspective. So, we're just scratching the surface here, but, I think it's so important. Cite the statistics, cite the magnitude of our distribution network, not just in the prescription drug world, but also in the ability to serve underserved populations and leverage resources that we're bringing in from the virtual perspective and obviously from the on-site perspective as well. So
I'm just going to make a side comment because you used one of those words there that I was looking to remember what it was, underserved populations. And I think that the inner city is a major part of that. So while that county may not be a rural county with no primary health care, there are major sections of the inner cities where people just don't have access to this type of thing as well. So pharmacy, no matter where it is, rural, suburban, or urban, can take advantage of what you're building.
Yeah, you pretty much cited it. It's, the biggest issue when you deal with health deserts, it's not just health deserts, it's inner cities, it's uninsured, it's your neighbor down the street who may have a high deductible, who may be suffering from a high deductible health plan, who may be underinsured, it may be easier for that neighbor to pursue the cash option. So when we talk about digital health, we're talking about an ecosystem that delivers a virtual healthcare platform that drives easy access to affordable healthcare. There's multiple tentacles to digital health. iCare Plus is what we're coining our brand for every one of those tentacles that we're going to distribute and to work with our pharmacies to optimize, our members to optimize as part of our virtual health care platform. And it's so important to be able to take a look at, what do our independent pharmacy members mean as the number one acute care provider in healthcare today, as the most trusted access point for information on drug interaction, for example. So, our goal is to leverage the pharmacist in the areas where there's a need for additional services. There's an opportunity to collaborate with local providers. There's an opportunity to collaborate with employer groups. There's an opportunity to generate data, but most importantly, the opportunity to intervene and drive face-to-face, or what we call synchronous encounters, through a digital platform, allowing that pharmacist to intervene, or allowing our member pharmacists to intervene with the patient's medication regimen and provide the necessary therapy to those patients if they cannot come into the pharmacy to receive that traditional one-on-one. That's very important, and that's become a true catalyst to what's driving IPC Digital Health.
So step us through, what are the pieces?
Well, first and foremost, we coined this the 5 pillars. So we basically, it's 5+ pillars of IPC Digital Health that represents our end-to-end solution. The first thing we're going to do is introduce a whole telehealth stream of services. We believe that's where the industry has gone. We believe we're poised to really optimize that connection between our pharmacies, patient and local providers, and national providers as well, employer groups, and the payer system. There's a lot of opportunity in that area. So that's pillar number 1. And I'll just give you an example. Services such as telemedicine, telepharmacy light, not your traditional telepharmacy, but more of a lighter version that creates that pharmacist-patient interaction outside of the pharmacy. And we're also going to leverage remote patient monitoring services.
Yeah, it's a big opportunity.
Yeah, along with medical device interoperability. Why I'm excited about that combination is because there's a little bit of everything that touches each type of patient: the uninsured, the cash patient, the underinsured, who can also be the cash patient. Then there are those services where we do have both public and private coverages that are available, so long as the platform is executed in the manner that it is intended to be executed. And I know it's kind of high level, but I'll tell you something. Historically, when virtual programs launched in our industry, I think too many of our competitors made it extremely complex for their user base. So you didn't get the type of execution that you would have really wanted. We're taking a much more simplified approach to launching, and I'm not going to release, and share the secret sauce right now. But I can tell you the one thing, and the buzz that you're going to hear about that pillar is that, wow, it's so easy to operate within IPC Digital Health's virtual platform. It's been easy to cater to the patients. We're seeing prescriptions come in. We're seeing actual reimbursement come in, and other benefits as well. The second pillar is we're going to get into home health and lab diagnostics. That's a huge category. In fact, home healthcare kits and lab diagnostics is not as complex as it used to be either. We're going to give our pharmacies the opportunity to really cater to patients that can't afford the traditional lab. And I'm excited about this because, we're going through an extremely well vetted program in the sense that we're working with labs that are CLIA and CAP certified, manufacturers that follow a quality protocol, and that really understand pharmacy in the sense of how can we position the pharmacist to utilize these types of programs as part of existing pharmacy services and clinical services, and then institute a follow-up through our virtual platform, to which never really existed in this manner. So I'm really excited with what we're going to be doing there. I think our members are going to be extremely pleased. We're also going to leverage our own, as you mentioned, Bruce, on the secondary wholesaler side. I mean, we deal with a lot of drugs. We have a lot of drugs that we distribute. In fact, I think one of our published numbers is I think we're right around 1.4 billion annual in terms of dollars that surround our distribution model. And so we have the opportunity to leverage a modern day prescription savings program that really positions our pharmacies to compete.
Oh, wow.
And to cater to that cash patient. So we're looking at some very unique products. Obviously, we're taking the crawl, walk, run philosophy. It's very important for us to make this easy, to start out slow, but then create a robust solution or offering where we can actually build into it and offer more NDCs as part of our prescription savings program. So not a lot of details there, other than it's not a program that will compete against your traditional prescription savings cards. This is unique to IPC, and we're calling it iCare Plus RX Pass. So I'm extremely excited to introduce this to the marketplace and allow our members to compete in that category. We don't stop there, Bruce and Todd. We looked at and we examined what are the gaps that exist in pharmacy and within our independent core, and how can we improve them and make them easier, not just increasing the value proposition from a revenue standpoint, but also provide programs that can reduce operational inefficiencies and provide cost savings in the manner that our members have been executing with certain programs over the years. For example, prescription delivery. It's a big issue. And there are wonderful partners out there, and one that I won't disclose right now that we will be working with truly understands pharmacy. And that's really big. I mean, part of the process of working with third-party partners is to make sure that they understand our profession. That's been a problem over the years in virtual healthcare and digital health, is that there's so many wonderful SaaS-based solutions, internet-based solutions that pharmacists have been pitched over the years, or the medical profession has been pitched over the years in terms of collaborative care. But many of those providers really struggle to understand the collaborative care connection, that circle of care. And number two, to really understand the pharmacy environment, the pharmacist's time, the pharmacist's task management. So, that's a big part of what we studied in terms of.
Yeah, I'll just illustrate that. I spent about an hour on the phone, a month or so ago with a company that's trying to deliver a new marketing service, for lack of a better word. It's more elaborate than that, but they kept talking about how they thought a pharmacy should be able to spend $2,000 or $3,000 a month on advertising to reach targeted people. And I started talking to them about, well, what kind of people? And they couldn't begin to believe or understand that pharmacists lose $50, $60, $70, $80 sometimes when they fill some of these brand name prescriptions. And it just blew their mind. And I lost a client because they wouldn't believe me that pharmacists weren't making money hand over fist. And that's just a common perception from outsiders, is that they look at all the drugs that are advertised on TV and they think, boy, these pharmacies must be making a lot of money filling prescriptions for these things. And so to your point, for people partnering with people who understand the workflow and the reimbursement issues that pharmacies are dealing with, that's a critical factor.
Oh, absolutely, Bruce. Absolutely. we looked at prescription delivery and we studied what are the problems that our members are facing, or community pharmacies facing. One is that it's expensive to deliver prescriptions. It's expensive to pay for that car insurance. It's expensive to own a vehicle, and it's time consuming from a velocity standpoint in the sense of your staff. However, it's a necessity and it's not going anywhere. So how do we improve it? Well, we take a look at what national providers understand pharmacy and what are they willing to do in order to conform to the independent pharmacy strategy. They've already proven they can conform to retail chain, but can they conform to the independent pharmacy strategy? So there was a challenge there, and there's I'm excited to get into what we're going to be deploying at some point. But we found that with this type of service element, it's not only a supplement, or it can also be a primary. It expands the range for some of our independent pharmacies in the sense of where they were delivering prescriptions to, and it allows them to take, especially those not only that are serving health deserts, but those that are in transient markets. They have the opportunity to capture that, and to really kind of get into that medical tourism, mobile patient mindset. And so, that's where dollars are left on the table. That's where the competitors are getting those prescriptions. Well, guess what? Our independent pharmacies are going to have the opportunity to take advantage of that. The other piece to this is people transport. When I looked at remote patient monitoring and I looked at what are the gaps in terms of how can we really improve this, make it easier, and go after the low-hanging fruit that's been left on the table for years, right? We looked at the one thing we don't talk about is how people transport, and getting that patient from point A to point B, regardless of where they are, is not only an essential part of a medication and medication adherence, but also the optimal health outcome of that patient. That's critical. So what does that really mean, right? Not going to just throw out more buzzwords just to throw out buzzwords. This is what it means. It means that payers and government plans are actually subsidizing that type of feature.
Yep.
It means that part of a care plan, although we're adopting a virtual element in order to optimize the number of encounters that are required, right? It's very important. You have to have encounters in order to really manage that patient's outcome. And digital health and that virtual connection between the pharmacist and the patient, and the physician and the patient that we're tying together, also encompasses the ability to get that patient to that face-to-face encounter that's part of an extended care plan for those critically ill patients. And so that was a gap that wasn't part of that comprehensive solution in the past. And so, it may have led to inaccuracies or billing deficits or billing issues in the past. So, we looked at that and thought that was a very important tentacle that we must absorb into our big picture. And finally, the final pillar consists of driving patient adherence programs. Patient adherence programs come in many forms. We're looking at specialty drugs. We're looking at brand manufacturers, for example. The high cost of those medications are enormous, and we do know that the manufacturers of such expensive drugs are subsidizing through copay assistance programs.
Right.
But here's a problem with copay assistance programs, right? They're wonderful, but here's the problem. They're geared towards the larger chains. Independent pharmacies over the years have not been able to capitalize on opportunities from copay assistance programs driven by the brands and driven by specialty manufacturers. And that's not the brand or the specialty manufacturer's fault, right? The fault is on the inability of our challenge has been come up with a product that makes sense so we can coexist and we can drive value to them, right? Through the use of our massive distribution network.
Yeah, so, which is where your distribution and your retail stuff comes together so nicely, isn't it?
Absolutely.
Yeah.
Absolutely. That's why we had to uniform the brand under iCare Plus. So we create a central adoption to a healthcare ecosystem that operates and enables that type of program to come to fruition. So we still have challenges. We have a big picture. We have a phase by phase approach that we're taking, so we can really perfect each level. We're going to learn as we deploy our program. But I'll tell you something, Bruce and Todd. We're proud in that we're finally giving our independent pharmacies the opportunity to compete against what the retail chains have done for years in terms of how they've evolved. Look at Walgreens and Village MD. Look at CVS and Minute Clinic. Look at Walmart Health.
Yeah.
Look at Rite Aid and Ready Clinic. Obviously the industry changes all the time, but I'll tell you this. We can't compete in independent pharmacy with our members unless we introduce programs like this that are meaningful and that position them to compete at a lower overhead and at a higher execution rate. That's how we compete, and that's how we drive profitability, and that's how we make our members successful. So that's the IPC Digital Health ecosystem.
You've pulled together a big collection of items and integrated them, I guess is the word I'm looking for, is you have all this in one place. So a pharmacy can manage all of this through the IPC Digital Health platform, and are we talking hardware here, or is it going to be done over the internet through existing stuff? What's this going to look like in somebody's pharmacy if they get involved, starting with telehealth?
Yeah, so we're not talking hardware. That's the beautiful thing about virtual healthcare, is that if you do it right, it's all, one of the things I mentioned earlier is all SaaS based, which is basically software on the internet. That's either licensable. We will get into our own proprietary down the road. Those are things that I think it's important. Remember, we're a pharmacy, we're a cooperative. So the benefit is to our members. Anything we get into that we can profit from, obviously it's a pass through to our members. And something obviously my CEO can talk to that much better than I can right now. But I'm sure he mentioned that a few times as well. So we're looking at various our primary solution to start out. It's like you said, it's not just that it's various elements that are part of one solution. It's that they all link to the storyline and the journey.
So that brings me back to some of our original conversations. Cash programs. Is this going to be able to bring more cash pay revenue to the pharmacies?
Yeah, 100%. We're setting this up so we can take advantage of as more and more Americans shift to cash because of those stats that I was talking to you about earlier that I cited. The program is being set up for significant cash reimbursement. We're looking at telepharmacy light menu of services that patients can participate with. We will be distributing home health kits directly from our stores at a purchase price that are very competitive to the industry. Not only that, but we'll be leveraging the expertise. And I'll tell you something, we have some of the best independent pharmacists and owners in the industry. I've been around for 20 years plus, and I've, like you, Bruce, I've been able to visit over the years many of these members. I spent a lot of my lifetime on the road visiting pharmacies and working with them. And I'll tell you, the ability to bring that patient to the back room, activate a kit on site, and undergo the entire process, very simple, very easy to execute through a cash protocol, not only saves the patient thousands and thousands of dollars, but also really shines that light on the pharmacy staff and the pharmacist's ability as they were meant to be, in the role that they were meant to play.
And, I just want to emphasize here that, the traditional paradigm that we operate under is that if insurance doesn't pay for it, people won't pay for it. And I've got to tell you, I've been preaching for years that that's in our heads only. That's not in reality. Everybody won't pay. Perhaps most people won't pay, but many people will. And this 52% number that you mentioned that are uninsured or underinsured, I mean, that's a huge number of people who are working as waitresses or, just part-time workers. The whole gig economy has got scores of mid-level professionals who have very high deductible insurance plans because they're paying for their insurance on their own. These people are out there, and there's an opportunity there. And I expect that this is that gap that you're talking about, that you're going to finally give the pharmacists the tools they can so that they can jump in and fill that gap. Am I right?
Absolutely. And we're talking about inexpensive services, inexpensive healthcare services for the cash patient. We're not talking about the types of exorbitant dollars that they have to pay, even for those that do have insurance, have to pay to meet their deductible, which most of us don't even meet if you're part of a high deductible health plan. We're talking about dollars that, nominal dollars that have high margin and high return for our members, that not only allow not only allow them to work with the patient to address a need, a healthcare need. Let's say if it's if from a monitoring standpoint or from a prevention standpoint, I mean, disease prevention is a big part of what we're doing here, but also controlling and managing an existing issue. That's critical to the process. And we're talking about inexpensive solutions, inexpensive service model that at least rewards our pharmacies in the current state that they're facing from a government perspective, that at least rewards them for the time and the effort that they expend with that patient. Number two, as I mentioned earlier, it's been complex historically to strengthen that relationship with the local provider. There was an article that was launched today, I think in today's digital issue of Drugstore News. It may have been circulating for about a week, that specifically cast a light on the pharmacist and the physician relationship and how it continues to strengthen and why. That's not a new issue. That's been there for years, right? And so we keep talking about those same stories because it's a new generation of leadership and care and providers that are coming to the table. Those that are more prone to use social media, or that are most prone to become more active in using virtual healthcare services as part of a collaborative care plan. So, right. We're on the cusp of that innovation. So rather than be passive, we're going to be ahead of the curve on this one. And so that's why we're excited.
Is there pharma or healthcare plan money playing any part of some of this stuff that you're bringing to the table?
So it's not something that I'm going to talk about right now, but it is part of our plan. Obviously, there is plan reimbursement that's happening today. So if it's there, we're building the tools to be able to leverage those dollars, whether it's private, whether it's public. So part of our program, they're definitely, I mean, it's being constructed to specifically take advantage of that low-hanging fruit. When we talk about health disparities and the dollars that are designed to compensate providers for addressing population health issues or health disparities, we're talking about millions and millions and millions of dollars that are left on the table because the providers don't have the right tools to be able to export, to be able to get the data that's required in order to fit the need of that plan in its simplest form, so they can justify the reimbursement in its simplest payback. So we've looked at everything all the way down to the data science. That's something I didn't talk too much about right now. But everything that we're doing is designed to be able to export the data that's required to filter it to the providers so we can, to the payers, so we can generate that low-hanging fruit and return it back to our members.
So this IPC initiative is being rolled out. Pharmacists will start hearing about it, I suspect, from IPC, from their field support personnel and from the marketing department. You're on the team now and driving this whole process forward. Any particular last words that you would want to share with our listeners that will help them anxiously look for the information?
Absolutely, Bruce. So a couple things. One, by the time the listeners, are able to digest the information from this session, a couple things they need to know. Number one, we're undergoing a rigorous testing program when this launches, so you can't expect it in the stores right away. We're taking a very important and a very disciplined approach to this to test it in different phases before we fully commercialize. So just want to make sure and level set there that there's no misconception that this is ready to go. We have a lot of work to do. We have a lot of testing to do. We have a lot of trial and error to undergo. And we will be doing these the testing in live pharmacies and obviously with the participation of patients and so forth. Number two, I'm excited about the opportunity to launch a digital health platform and that we're going to breed innovation. To do that, we need vendors, we need digital innovators that understand virtual healthcare, that understand pharmacy, that understand the collaborative care, whose devices really make sense, whose software makes sense to today's pharmacy, to today's patient from both cash and insurance perspective. So we're listening to anybody and everybody that has unique solutions in the virtual and the digital world. I would encourage you to reach out to us. I would encourage you to reach out to me. I'm easy to find. But do your homework. Make sure that you understand that, look, pharmacy is X. It's not like Y. And really kind of dig in there, understand what task flow means in terms of the pharmacist, understand what are the pain points that have been impacting our industry, and come to the table with a solution. And we're willing to listen and perhaps team up and have you join in to our future our goals.
Well, that's going to cause me to remember a conversation I had not long ago with a pretty sophisticated company with a diabetes device, eagerly trying to approach physicians to get them to prescribe the thing. And I'm talking to them about, well, what's wrong? Why not talk to pharmacists? And vendors typically don't understand that pharmacists can create demand. The relationship the pharmacist has with the prescriber, if they can go to a prescriber with a solution for Mrs. Jones or Mary Smith or whatever who's experiencing a problem with maintaining adherence or meeting, metrics, and come with a solution, the pharmacist can be in a position to create the physician prescription. And I think that's a major thing for us. I'm not a pharmacist, but I mean, for pharmacists to understand is they don't have to be the end point of filling the prescription or the service. They can be the person who creates the demand for the service. And as they do that, more products and services will come to them and more revenue will follow that.
Oh, 100%. We have some pretty exciting things on the horizon. And I don't mind sharing that right now. We're looking at launching what we call an innovation week, where we do invite, your startups, your med tech, providers, the company that you're referring to, perhaps, but they have to do their homework first. There's definitely criteria that they need to meet before, they come into our innovation week. And it's an opportunity to listen to them. We're going to lay out we're just in phase 1, right? But this is a long journey, in the sense that long journey for the user, for all the end users. Healthcare is evolving. This isn't a one and done program. This is our new foundation, the fabric of our existence, 5-10 years from now, to complement and to support the prescription side. This is the adherence side. This is the health outcome side. So we're going to continue to do some great things. You're going to continue to hear the buzz, in the sense of things that we're introducing. Really, the uniform brand position puts us in that driver's seat to be able to do these things, as opposed to just one-offs here and there. So we're excited, really excited.
Well, and I'm thrilled that you've spent time with us today. So IPC Digital Health and iCare RX is the product offering, or what you're branding it under, for this new division of IPC, or the independent pharmacy. iCare Plus. Thank you.
You got it.
So IPC Digital Health, iCare Plus. Be watching for it. Ashton, I've seen you do some marvelous things throughout your career, and I'm eager to see this thing start coming to market, and for pharmacists to start understanding that there's a bright future. I think one of the terms that Marcus Sensa used before was future-proof pharmacy, and I love that notion. So with that, I'm going to sign off for Pharmacy Crossroads today. Thank you all for listening. I hope something you heard here today will help you do more and be better.
Thanks for listening to Pharmacy Crossroads. If you're interested in talking with Bruce, please contact the show. Visit pharmacycrossroads.com. We look forward to hearing from you.